Great. Hi, good morning, everybody, and thank you so much for having me. Thank you so much, Jenna, for the introduction. Today's webinar is intersecting a little bit about what Jana had mentioned in the introduction. I have experience with and practice in trauma healing and resiliency practices, but I'm also a longtime community organizer with tenants' rights and housing, and I'm trying to bridge the two together because I see the great need and the intersection between public health and individual health and housing and tenant rights. So this presentation today is going to be focusing on that. So I'll go ahead and get started. A little bit more about me. As I mentioned, I'm also part of a healing collective called Cambio Colectivo, or Collective Change. We're a group of facilitators and trainers that does a lot of staff development and direct practice with communities around like nonviolent communication, parenting with nonviolence, healing practices, self-care and wellness practices, and we also help organizations implement trauma-informed care practices in their organizational settings as well. We're going to be talking a lot about stress and trauma and health, which can be very heavy stuff. So I wanted to start us out with a little bit of grounding. So I want to invite you all to just get comfortable in wherever you're at. If you're sitting or standing, to just get comfortable. Try to soften your muscles, your tension, loosen anything in your shoulders or in your legs. If you're sitting down or you're standing, just notice your feet on the floor. Notice the weight pressing down into the earth, connection with earth and connection with your environment. If you're sitting, notice your weight in your chair. Notice your back against anything that's helping it, if you're in a chair or in a couch or a sitting position. Just feeling safe, grounded, attached, connected. And then you can just notice your breath going in and out. Don't try to change it. Just notice it. Is it short? Is it fast? Deep? Try to follow any sensations that you might be having in your body. Are they big, small, cold, hot? Describe them to yourself. All right. Okay, so I'm gonna invite you all to bring yourselves back into your body, back into the present, into the presentation. Thank you for everyone for following me in that. So what we're going to talk about today is sort of like, what do we mean by health and what do we mean by housing? And then we're going to talk a little bit about the intersection between habitability and health. And then at the end, we'll talk a little bit about stress, trauma, and housing. And then mixed into it, we're going to talk about the different types of stress and trauma that we might experience both inside and outside the home, and how that impacts our health as it relates to where we live. So I'll start by saying, like, what do we mean by health? When we talk about health, we usually get the message that it's about physical health, but we really want to be holistic in our practice of health, and that includes emotional well-being, mental health, even spiritual health, whatever that spiritual practice may be for you, and also community health. Because we don't just live inside our homes. We also, our homes reside within a community, and what happens in that community also impacts what happens in the home, and can also impact all these different forms of health. Oh, and by the way, if you have any questions or anything comes up or you need any clarification, feel free to put it in the chat, and then I'll try to see if I can attend to that. Okay, so what makes housing important? I mean, housing and where we live, I mean, it's the place where we go to rest. It's the place that we go to relax, to recuperate from a long day or stressful events. It's a place where we build family and relationships, where we strengthen relationships. It's a place where we're supposed to feel safe and secure. And housing is just one of the most basic human needs is a shelter. I think other things that I thought about after making this presentation is also like education and information. It's where we go and where we might learn, especially in this time of COVID. Children are learning at home, and so our families, we do a lot of education and socialization in the house as well. So housing is a really big part of our lives and what makes up our lives and how healthy and well-being and our well-being. So I want to start by talking about habitability, right? According to the law and according to the state, it says that a unit should be habitable to live in, and that means that it is fit for occupation by human beings and substantially complies with state and local building and health codes. So a lot of what happens, a lot of the conditions inside the home are determined by these building codes and these health codes that are brought forward by not only the state, but also our local government. So like the County of Los Angeles has its own building and health codes, and so do the cities that you live in have their own building and health codes. What the state provides is a very general, broad sort of a code manual, and then it gets a little bit more refined as you get down to the city level. So the habitability means that an apartment or a home should be free from any one of these different things. And as home health providers, just something to look out for when you're in somebody's home and they might be experiencing any of these different things. These are all violations of codes. And it's not exhaustive, meaning that there might be other code violations that are not on this list, but these are some of the more common ones that we hear of, like lack of or no hot water, missing or broken smoking carbon monoxide detectors, leaking ceiling walls, holes in the carpet or floor, lack of or inadequate heat. I know we live in Los Angeles, which is warm most of the time, but the law states that you still have to have a working heater. If you have any missing or broken windows or screens, those can be health violations. And then the common ones of infestations, inadequate trash collection is also one, because that might attract vermin and other insects. Even the surroundings, if people have stairs or railings, those have to be kept up to code. If people have security doors that have to get into the building, those have to be functioning. And also just like defective electrical wiring, it can be a hazard as well. So what are some of the health problems that come with maybe some of those bad habitability conditions? Asthma is a huge one. You know, there's so many asthma triggers with like old carpets or dust mites, mold, humidity. All of these things can trigger asthma and actually even cause asthma in some extreme circumstances. Allergies can be triggered by the habitability conditions in the home. There can be damage to the nervous system and learning disabilities, especially like when we're talking about lead paint. These are really toxic chemicals that can really inhibit people's development or children's development and learning. Behavioral problems, especially coming with like some really bad conditions, it can actually cause a lot of stress and, you know, lead to a lot of behavioral issues as well. Lung cancer is something that's been linked to bad habitability conditions. And then there's like just injuries and burns, wounds, poisoning from certain, it can be like from the rat feces or the roach feces. These can actually dry up and get into the air, and we inhale them, and it can actually cause poisoning. And then there's just the general stress of living in bad conditions, and that can also be toxic because it happens on a daily, right? So just being mindful that the conditions in which we live can actually have a direct impact on our health as well. So what are some of the habitability conditions, examples of poor conditions, like old carpets? As I mentioned, mice, rats, and roaches, they leave feces. Those can dry up and then get into the air, and then we breathe them in. Insects, bed bugs, dust mites, with those come with like bites or allergic reactions. Poor air circulation, humidity, mold, lead paint, exposed wiring. Obviously, you can get electric shock. And then broken windows and screens. Those are important because then those keep the insects out and mosquitoes out and things of that sort. So it's important to make sure that those are working properly. We get a lot of concern around smoke or people that smoke in the vicinity. That can trigger asthma and allergies as well. Also, just like the chemicals that are being used for fumigation, they can have allergic reactions or bad reactions to folks. Broken doors and locks, that just goes to safety, and also stairs and handrails. People can, fall and injure themselves that way. So these are just a few. I'm sure that we can probably come up with a lot more, but just to be mindful of some of the health conditions that can arise from poor conditions. So what about community conditions and some other things that may not be linked to habitability? One really common one is overcrowding. Too many people in the home, that can cause a lot of stress and strain. It can both on relationships and on one's own well-being, and then that can then just lead to other health issues. Mental health issues, if we have folks with special needs or developmental disabilities in the home, or people that have other mental health diagnoses, that can lead to a lot of stress in the home as well. Economic problems, having trouble paying the rent, or concern around paying the rent, or buying food or medicine. I mean, these are all things that can lead to stress as well. No privacy. Children in overcrowded homes or living in bad conditions have been shown to have poor academic performance. Then there's the exposures to like domestic violence. Obesity is sort of like a result of poor coping mechanisms. And then there's like few places to exercise or just to relax. You might not be living near a park or something like that. And then some of these other things as well. I mean, walking around your neighborhood, if there's no parking, that's stressful. If there's neighborhoods which are riddled with graffiti or trash and things of litter, those can also impact health in the home. And then there's just like environmental pollution. Studies show that people that are low income or people of color usually are exposed to more environmental impacts and pollutants than most, right? So just some things to be conscious of. So now I want to lead into, those are like kind of like the physical symptoms and conditions, and so I want to talk a little bit about like stress and trauma, what it is, and what does this have to do with housing and how they intersect. So stress and trauma have different names, a variety of different names, and these are just some of them. You as home health care workers probably are familiar with ACEs, or adverse childhood experiences. And then we're going to talk a little bit about the pair of ACEs and how those intersect. But these are just some of the names that you hear out there to describe stress and trauma. But there's a variety of them, but I think we use them interchangeably. So what are some sources of stress and trauma? There's like the direct personal experiences that we get on a daily or during our lifetime. There's also a growing field of study that is studying intergenerational or historic trauma. This is through like the field of eugenics and studying how trauma changes our DNA structure and our genes, and then we can pass those predispositions down to our children. And then I'll get into systemic and community trauma, because this is an area that is not well researched or talked about, but it is an emerging field of study to really talk about how our environment and the communities that we live in lend to our stress and our trauma. And then as healthcare providers, such as yourselves, myself as an organizer, and just any advocate or counselor, I mean, really talking about vicarious or secondary trauma. And then we'll get a little bit into that as well. So here's like some lists of different types of trauma. We categorize them as sort of like big T trauma, little t trauma, and then C trauma can be compounded or complex or cumulative trauma. But I just want to make a note as you're looking down this list is that what might be a little t trauma for somebody can be a big T trauma for someone else, right? So this isn't supposed to prescribe like this is a small thing and you shouldn't get stressed or traumatized over it, because we all react to stress and trauma differently based on our interpretation and our histories. So this isn't meant to suggest that one thing is more pervasive or impactful than another thing. Like I know people that have been really traumatized by dog bites, right? And others that it's like, oh, okay, well, I still love dogs even after I've been bitten by a dog. So again, it's not to suggest that everybody is going to react or be impacted the same way. But I want to turn your attention to the cumulative trauma, because this is where we're going to talk about community and systemic trauma. And these are a lot of the things that we hear and we might experience in our own lives, but we hear in the news, especially today. Today, with COVID happening, which is a global pandemic, can be very traumatizing. All of that comes with COVID, like having to stay at home, not working, not knowing like how you're going to pay rent or if you're going to lose your home. The kids are at home, having to deal with education and childcare. I mean, these are all very stressful and impactful things that come from just having a pandemic. But we also seen like with all of the protests and the movement for Black Lives, sort of like the police violence and the things that we don't think about as trauma, which can be like institutional racism or poverty. These can also be compounded because it's something that we deal with on a regular basis. It's not a one-time event. So stress and trauma at home. These are like some examples of how where we live and what happens in the home can also lead to stress and trauma, right? Domestic violence, whether it's spousal, adult, or child abuse. Just living in poverty has been shown to be these can be very stressful, and happening on the daily can be very traumatic. Or just like homelessness or the threat of being homelessness. I mean, getting notices on your door, getting an eviction notice, being harassed or retaliated against by owners and management. These can be highly stressful and traumatic. And then there's just the isms and oppression, racism, classism, ageism, all the different isms. List goes on and on, right? But all the different oppressive methods that people utilize against one another. Overcrowding can be a very stressful and traumatic experience. It's hard living with a lot of people when you don't have a place to go and relax, right? So how are you going to recuperate? How are you going to regenerate? How are you going to relax and get ready for the next day in an overcrowded space? It's really hard. And then there's all the physical illnesses that come with it, like especially during COVID. I mean, if you have a family member or somebody that has been diagnosed with COVID, all that entails, whether that's separation or just being worried that other people are going to get sick, and then just having injuries or death in the home can also be very traumatic. I think another trauma that I thought of was just moving. Moving studies have shown that moving can be as stressful or as traumatic as the death of a loved one. So if people have to constantly move because of evictions or things of that sort, that is something that gets compounded too. So community and systemic trauma. So this is, I want you to pay attention to the roots in this image. I mean, these are some of the things that we talked about in the C column trauma, is like poverty, discrimination, poor housing quality and affordability, and just general violence. And then the pair of ACEs, or the adverse childhood experiences, which you might be familiar with already, is all of the things that we might experience growing up, right? And as adults, if we've already have a history of adverse childhood experiences, then all the systemic and community experiences that we have can then just exacerbate that or re-traumatize us, right? So there is a direct connection between what happens in the community and in our systems and in our social structures and what happens to us as an individual. And this is, again, a field of study that is being more thought of. So structural violence, individuals, families, and community experience harm from economic and social structures. Like we're seeing this right now, right? Like with the unemployment and the money that's going out to help people in times of need because of COVID. Social structures can be like, maybe you don't have access to a park, or maybe you don't have access to a grocery store or healthy food or things of that sort. Social institutions can be violent as well. We notice this in our judicial system or in our police system. Also, I mean, we deal with children and families. So, I mean, Department of Children and Family Services, just taking children away from homes can also be very violent and traumatic. School systems, we see our children being reprimanded, or they're being expelled, or for things that don't need to lead to that. So there's all sorts of ways that we experience structural violence, and that's important to note, because this also leads to our ability to cope and be healthy. And then there's just like the inequality and inequity that may harm people and communities, from preventing them from meeting their basic needs, which is food, water, shelter, and social relationships. So as care providers, this is something to be very cognizant of and conscious of. We can experience vicarious, or what's called secondary trauma. People even refer to it as compassion fatigue. I mean, we're in this field because we care and we want to help people, right? But in the process of helping people, we listen to stories, we experience stories, we experience experiences that of the people that we're helping, and we start to absorb this stuff, right? And so the symptoms that we would experience as care providers are going to be the same symptoms that the people that are experiencing the trauma, or the people that we're helping, are going to experience as well, which is why self-care and wellness practices and having that part of your organizational culture is so important, because it's hard. It's hard to see this day in and day out, sometimes feeling like your hands are tied and you can't do much more. I mean, that's really stressful, especially for somebody that all they want to do is help, right? So just being mindful that that as care providers, you also need to take care of yourself, put your oxygen mask on first, and so then that way you can be conscious and help others. All right, so a lot of heavy stuff. So I'm gonna invite you to just take your hands and shake them out, get all that energy out. Don't stay with it, don't stick with it. If something came up for you, just shake it out, shake your legs. Just get it out of your system. If you want to touch your hands to a wall or touch it to the floor, ground it, and just get it out. That stuff can be heavy sometimes. Okay. So I wanted to show you a quick, so this is like what trauma and stress does to your nervous system, right? Because we just talk about stress and trauma, and it's not just mental. It actually impacts you physiologically and biologically. So I'm going to show this quick video to show you kind of like what your body does when it's in a stressful state. So your sympathetic nervous system, which is also like the lower part of your brain, it controls all of your body functions, your heart rate, your pupils, digestion, you know, all of these things. And so when you are in a fear state, this is what your nervous system does. It activates all of these different parts. It shuts down all of your digestion. It inhibits production of saliva. It inhibits the liver, the kidneys, and the gallbladder. It shuts all of those things off because your brain thinks that it's in danger. And so what it really needs to do is it needs to pump oxygen and blood throughout your body. So you have increased muscle strength because your brain is going into fight or flight or freeze mode. It thinks it's in danger, right? And so it starts activating all of these different parts in your body and shutting down other parts, right? So if you are constantly stressed or feeling constantly stressed, your body is overworking itself. And if it overworks itself, it's sort of like I say, it's like having the gas pedal to the metal in your car. After a while, the engine's going to blow, right? You can't live like that constantly. So you have to activate the parasympathetic nervous system to slow down your heart rate and bring your body back into balance and normalcy, which is why self-care practices and wellness practices are so important, because you don't want your body in that constant state of arousal and hyperarousal in some situations, right? So this slide here just talks about, like, you know, trauma leads to behavior, right? And behavior is just trying to meet our basic human needs, right? And so if we don't know how to meet those basic human needs, then our behavior manifests in all sorts of different types of ways to try to deal with stress and trauma. And this slide here just shows some of those ways that it shows. There's all sorts of other different ways, right? Some non-healthy coping mechanisms like alcohol and drugs, or just a lot of anger, self-harm, you know, or just like inability to trust or having low self-esteem. You know, these are all behavioral manifestations of us trying to meet our basic human needs, which can stem from stress and trauma. So let's talk about the community and systemic, sort of like the intersection between individual experience and the experience that we have in the community. So this is a slide that was that I took out of a research paper that was done talking about systemic trauma. And we're gonna zoom into these in a little bit, but I just want you to see kind of like the arrows, how they intersect, how it's like cyclical, how like you start with the individual and the individual trauma, and then they're part of a community, and then that leads to symptoms, and then that community goes back and then triggers the individual. It's a cycle, and it's all connected. We can't talk about trauma without talking about the systems and the community trauma that also exacerbate or lend itself to our own individual experiences, right? So here's a close-up. Like, for example, there's the individual. You know, they might be experiencing emotional numbing, avoiding, increased arousal, these kind of things. Structural violence, that, like we talked about, all the different social structures and social systems that we might participate in, or even just like the threat of violence or loss, right? That could be, again, like evictions or habitability conditions, you know. And so all of these things come and they impact the individual. And then the individual goes out and is part of a community, you know. And if they don't have healthy coping mechanisms or even understand that they have trauma or stress, and they start to act that out or play that out in their behavior, well, then they're going to impact the people around them. And then those people are going to impact the people around them. It becomes sort of like a really negative viral way of getting out there, right? And then although a lot of our leaders and politicians, they come from trauma too. And so the decisions that they make and the laws that they pass come from a place of trauma and stress, right? So the systems that they create or that are created because of that then just lend themselves back to the individual as well. And in this sort of like Venn diagram, the circles, you can see the different type of community symptoms that we see because of community trauma. And I really want to focus in on this because we look at what's happening to folks out in the community, sometimes with a negative lens and a negative stigma, like unemployment or homelessness or mental illness. And these are all symptoms of a system that is just lending itself to that trauma, right? Our relationships, I think we see it, or just people not wanting to engage politically and socially. It's just because, again, distrust, lack of confidence, lack of self-esteem. So our behaviors and our participation in the community are directly connected to our individual experiences and our stress. So this is why trauma-informed care is so important, and I understand that many of you, if not all of you, are already sort of educated and informed on this in this practice. Trauma-informed care is about choice, right? It's just allowing everybody the choice to participate, to stop, leave, etc. Like right now, if you're feeling stressed, get up and walk out, go walk around, take a sip of water, do something that will help care for yourself and help bring your stress level down. It's about safety, and like I said, it's not just about physical safety, it's about emotional and spiritual safety as well. So when we are with people or in groups, making sure that everybody is feeling safe, right? And if they're not, then make accommodations to bring that about. Radical acceptance and understanding, because we have to accept people's histories and where they come from and why they do the things they do, and understand that their behaviors or their patterns or whatever it is that we're attending to might come from a different place in their past that they may not have had any responsibility for, right? So just taking into account and trying to understand their histories, what their current experiences are, what their triggers are, and meet them where they're at, right? Don't try to force them to be where you are, but take a step forward and meet them where they're at. And also in our field and in all of our work is just being a compassionate witness and reflecting, listening with empathy and compassion. Don't try to fix things or eliminate their feelings or needs, because they're real for them, right? And just help them reflect on their experiences, learn from them, and try to figure out new strategies of coping and dealing with stress. See, these are some trauma-informed community building principles. It's like just, you know, like sort of like the oath that doctors take is like do no harm, right? So that's in the work that we do. Let's try not to do more harm as we're trying to help people. Just accept, you know, like be accepting of where people are at. Try to empower folks in the community and the community at large. Just getting them more involved civically, politically, or just in organizations in the community. And it's also really important to be reflective, because it's one thing to experience something, and it's another thing to be able to reflect on that experience, what led to those feelings, what are the needs that I'm having and that I'm trying to meet. The reflective practice is both for yourselves as caregivers, but also for the people that you're working with, because as caregivers, we might be triggered too by what we see and experience. And then taking time to reflect on that experience and where those triggers came from and why we were triggered is important. It's an important path for our own healing as well. So this is a great quote that I got from that research paper is no epidemic has ever been resolved by paying attention to the treatment of the affected individual. And what this quote suggests is that because we might be working with people on an individual basis and on a direct basis, but they're still going out to a community that is re-traumatizing them, or they're still experiencing systemic trauma through like their living situation, their habitability conditions, whether they're overcrowded, whether they're able to pay rent. These are things that are still being imposed on them that may not be any fault of their own. Right? And so we can't just think that we're going to help people heal and help the community heal or improve community just by focusing on the individual. We have to focus on the systems and the structures of the communities that they are a part of and that we are a part of as well. So our homes, our health, our community, right? So we say like advocate for a healthy home, you know, both for yourselves and for the people that you work with. Advocate for a healthy community, get involved in local community groups and support better living environments. Advocate for systems change, both for yourself and for the people that you work with. Get involved civically, know who your leaders are, always vote to and encourage others to vote if you can yourself. And don't be afraid to speak truth to power. It's the only way that we're going to get the solutions. I always say, if there's no problem, there's no solution. So people and our political leaders have to hear that we're having these problems so that we can then advocate for a solution to those problems. And I think that will do it for us. So thank you so very much for your time and your attention. My name is again Jorge Rivera. I have an email address with Tenants Together at jorge@tenantstogether.org. If you have any housing or renter or tenant related issues that you need to email me about, feel free to email me there. If you have any questions around healing or trauma healing and resiliency practices or things of that, you can email me at jorge@cambiocolectivo.org. This is just an introduction to all of these different areas, right? We can do a whole training on just community resilience. We can do a whole training on just trauma-informed care. We can do a whole training on just health habitability stuff. So this is just sort of like an overview, and so I want you to just take away what you can with it. We will be sharing out the PDF versions of these slides, so you'll be able to have reference to them, and hopefully you got something out of this, right? And if there's any questions, I just want to open it up for questions. And again, thank you.
Thank you so much, Jorge, for that wonderful presentation. We haven't had any questions for you. We've had like a lot of like logistical questions, but nothing for you this far. I'm going to give it a few more minutes though to see if anyone puts anything in the chat box. So if you have any questions for Jorge, just put those in the chat box and we can read them out and he can go ahead and answer them right now. Okay, Sam has, Ask question about fumigation. Frequently getting fumigated for cockroaches. Why? So, Sam, I'm assuming you want to know why you're having to get fumigated for cockroaches so frequently.
Good question. So there's a new law. There's a new law that was passed that states that prior to any fumigation, they have to disclose what chemicals they're using, because before folks didn't know what chemicals were being used, and a lot of people were being impacted or being affected by those chemicals. So first, advocate to know what chemicals are being used for fumigation. The other part of that is a lot of code enforcement inspectors say that if a home is sealed well, the way it's supposed to be sealed, you shouldn't have any roach infestation problems because they won't be able to get in, right? So if there is roach infestation issues, the regular fumigation practices of just like spraying or around the apartment or inside the apartment may not be effective, because those roaches might already be in the walls, and so no amount of spraying or fumigating inside the home might impact that. I always advocate for folks that are in that situation to come together collectively and try to demand better fumigation practices and sealing up of all the different holes in the apartment. But yeah, if you can try to make a request to the property owner to do all of that. If they're still not attending to it, then the next step is to call like your health department or your code enforcement department in the city to have them come out, do an inspection, and then they will send the owner a notice to fix things. Otherwise, they would be fined. So I would do that.
Okay, great. And then Jesse has a question. How can families advocate for these things? Should they document, and who do they need to reach? And then her follow-up question was, are there local community advocate groups where families can get more involved?
Absolutely. Yeah, the first thing we recommend is document, and communicate with the property owner or the management company via writing. We have a lot of tenants that have a tendency of communicating verbally or via text. And because I'm always thinking about if this has to go to a lawsuit, we want to have the proof, right? And that has to be in writing. So write a letter, list all of the things that you want fixed in that letter, and then mail it certified mail in order to have proof that it was received. Don't ask for a return receipt, because they'll never sign for it and then they'll claim they never got it. Just send it certified mail. Keep a copy for yourself for your own records. If they don't repair things within a reasonable amount of time, like 30 days, then I would take the next step and call the city health department or the county health department or the city code enforcement department to have them do their own inspection, and then you can have that report as proof that repairs and maintenance are needed. As far as local community groups, yeah, there's tons in the city and the county of LA. If you would like, email me your area that you're thinking about, or the city that you're thinking about, and then I can probably connect you to more specific groups within that area. But there's tons. Yeah. Always a risk of getting rents raised if you try consensus. Well, right now, depending, there's a whole bunch of laws that protect against rent raising if you ask for repairs and maintenance. So if you have questions or concerns around that, feel free to email me, and then I'd be happy to take that on, because I need to know the specifics to be able to advise or counsel you better. But according to the law, if you request repairs in writing, if they try to raise your rent within 180 days of asking for those repairs, that's considered retaliation and it's illegal. And so again, another reason why it's important to document that you requested the repairs in writing, because if they try to do that, then you can push back. How do I find out the management company address? Oh, that's a good question. Well, if there's a management company that's involved in like the building or the complex, they should be providing you that information. It should be either in the contract or in the lease agreement. Any notifications that they send you usually should have their contact information. If not, if you have the name of the company address, I usually just try to do a Google search to see if I can find them that way. It seems highly suspect that if there is a management company involved, that they haven't provided you that information. So I would be concerned, and I'm always like weary about that. It's possible that there is no management company involved, and there's just an on-site manager that is hired by the owner, and so there's no official company. So that may be another reason why you don't have the company name or the address, because there is no official company. It's just like an employee. But as far as sending letters, if you need to send a letter somewhere and you don't have any other address, but you have an on-site manager, send it to the on-site manager, because that on-site manager works as an employee and a representative of the owner. So you can just send it directly to them. As long as you have a copy and you have proof that it was mailed by certified mail, that's all you need. So it sounds like Sam is also saying that they may not have a contract and they don't know the name of the management company. Again, whoever it is that they're paying their rent to, that's where I would direct any correspondence, because that person is acting as an agent of the owner.
All right, well, if there are no more questions, we can end this and go to the next when we're doing the same webinar in Spanish next. So if you wanted to listen to it again in Spanish, you're more than welcome to join us. Thank you so much for this excellent information, Jorge. Thank you so much for attending today. And be sure to check out the recording on the website that I posted earlier, and we'll be sure to send out the PDF of the slides as well.
Great. Thank you. Thank you all. Have a wonderful day.